about vaccine, important prevention strategy that we have available to protect us against COVID, as well as the new variants. But we also know that the booster shot is recommended now for everyone 12 years of age and older to provide that optimal protection within our community. And when we think about the vaccine as well as the booster shots, they are still free. And when we look at the data, it shows us that masks work, and it really helps to reduce the spread of COVID-19, especially when we're indoors. And as we've heard from Dr. Weston, as well as other public health experts, a well-fitting mask is really key to preventing the spread. And so a mask pulled down under your nose or hanging on your ear, it doesn't do anyone any good. And so I know we're all tired of wearing masks. There is some fatigue out there, but this is not the time for us to let our guard down. Masks provide an additional layer of protection, and it really helps to reduce the spread of this virus. And if you need another reason, I mean, it's getting colder, so consider a mask as a way to stay warm if you want. But by now, I'm sure we all know someone who has had COVID. And with that comes a lot of questions. But we'll hear more about this in the briefing, but I want to remind people that if you're not feeling well, it's important that you get tested, but also stay home. And most people who are vaccinated and boosted, they will have some mild COVID-19 symptoms, but it's still important to stay home to minimize the spread of this virus. And I would say that right here in Milwaukee County, we're going to continue to make strides in getting more employees vaccinated. And as of just last week, 97.2% of Milwaukee County employees were subject to our COVID vaccine mandate are either vaccinated or have received some type of an exemption. And so for reference, 97% equates to 3,422 Milwaukee County employees. And this number is up by about 56 employees from when I last provided an update back in mid-December. But of that 97%, 88% have a verified vaccination or are pending a vaccination verification. But this data that I'm talking about, this does exclude staff who are part of law enforcement or firefighter unions, and this also excludes elected officials. But Milwaukee County's employee vaccination rate, this is encouraging, but I also think that this is a signal to the broader community about how serious we take the health and well-being of not only our employees, but everyone that we serve throughout our system. And I honestly can't reiterate enough that increasing the vaccination rate throughout Milwaukee County helps keep everyone safe, no matter what. And so throughout the COVID-19 pandemic, county leaders, we prioritize policies that reinforce our commitment to health equity. And because of the contagiousness of Omicron variant, but as well as the increased disease burden that we were experiencing at the House of Corrections, we've enhanced many of our COVID-19 measures to reduce the community spread among our residents. And some of these measures include that transfers need to be in our care for at least 5 days and have a negative COVID test within 48 hours of transferring to the House of Corrections. Or if an individual tests positive for COVID-19, that resident will stay in a quarantine unit for 14 days, but be tested 2 days before the end of that quarantine. And then upon receiving that negative test, a resident is moved back into the general population units. But we've also reduced the number of people in a pod. It used to be about 60 to 70, and we reduced that to 40 residents to allow for more space for physical distancing. And we also give all of our residents are given 2 surgical masks per week, and our correctional officers wear KN95 masks in our general population units, but are required to wear N95 masks in our COVID positive units. In heavily trafficked areas that we see at the House of Corrections, they're power washed regularly, and we have a UVC robot that cleans and disinfects other areas throughout the building. But since implementing these additional COVID-19 measures, we have seen a decrease in COVID cases among our residents at the House of Corrections. And so I really am glad to see the strides that we are making as a community, but we still have a long way to go. This pandemic is not behind us at all. So I want to ask everybody to continue to do your part in keeping our community safe. And that's getting vaccinated, that's getting boosted, that's wearing your mask, washing your hands, washing your distance, but also making sure that you stay home if you're sick. So thank you. And with that, I'd like to hand it over to Mayor Cavalier Johnson.
Great. Thank you so much, Mr. County Executive I'm Mayor Cavalier Johnson, and I'd like to say good afternoon to everyone who's here. Just to drive right in, as the Omicron variant continues to spread quickly through our community, the health department has been busy, very busy, distributing 500,000 N95 masks that it received from the state last Friday. These higher quality masks that were distributed yesterday and continue to be distributed, like N95 and KN95, offer greater protection against the COVID-19 virus. These masks have been distributed at our testing and vaccination sites. No testing or vaccination was required to receive any of the free masks that we've been giving out. Individuals were given 5 masks and families were receiving 20 masks. As to be expected, demand for the masks has been high. And as of this morning, we had already given out 400,000 masks. At this point in the day, we've completely exhausted our full supply of these masks. We're partnering with the state to secure more masks in the future. An update on gating metrics for COVID-19. We remain in the extreme transmission category for COVID-19 cases per 100,000. That's down 590.9 cases per 100,000. And our percent positivity rate also remains in the extreme transmission category, down to 37.1%. On vaccination rates, 61.3% of city of Milwaukee adults, those are individuals, again, who are 16 years of age or older, they're fully vaccinated. 66.6% of adults have received at least one dose of a COVID-19 vaccine, and 37% of all adults are fully vaccinated with a booster. Please note that our current data is impacted by processing delays due to the recent high volume of tests. These numbers may increase in the coming days after backlog tests are reported and processed. On clinics and the need for vaccine, we've directed a lot of attention to masks over recent days. And yes, as the county executive said, masks can be helpful. Masks, though, cannot distract us from the most important thing to do to fight COVID. And that most important step is vaccination. I've said it time and again. Our numbers are far too low with vaccination, and we need to move those numbers up. Vaccinations are keeping people out of the hospital. Vaccinations are helpful at reducing the spread of COVID. Vaccinations are making Milwaukee safer. The percentage of Milwaukeeans, again, who are fully vaccinated is unacceptably low. That's got to change. We know that vaccinations are safe. We know that vaccinations are effective. Vaccinations are also free and widely available. And from personal experience, I can say that they're pretty painless too. If COVID has taught us anything, it's that we're in this pandemic together. And the best way out of the pandemic is vaccination. So let's work together to get more people vaccinated in the city of Milwaukee and throughout Milwaukee County. The health department is offering the following mobile vaccine clinics this week in the community. Tomorrow on Wednesday, January 12th, from 10 a.m. until 2 p.m. at the UWM Union, from 1 to 4 p.m. at Ascension All Saints Family Health Center. On Thursday, January 13th, from 3 to 5 at Fratney School, from 3 to 5 on Thursday as well at Walker's Point Community Clinic. Friday, January 14th, from 11 to 3 at Greater New Birth Church. Saturday, January 15th, from 10 a.m. until 12:30 p.m. at the Pfizer Forum Marquette game. From 4:30 until 7 p.m. at Pfizer Forum for the Bucks game on the Saturday as well. On Sunday, January 16th, from noon to 2 at the Burmese Community Center of Wisconsin, from 10 a.m. until 3 p.m. at the Quality of Life Center. Vaccines and boosters are always available at the health department's community locations at the Northwest, South Side, and Menominee Valley sites. And so the public is aware these sites will continue their normal hours of operation during the Martin Luther King Jr. holiday, which is next Monday, January 17th. Following FDA and CDC approval, the Milwaukee Health Department Monday expanded the administration of booster doses of Pfizer and Moderna COVID-19 vaccines at all clinics. This means that for those who are 12 to 15 years of age, they can now receive a booster dose. The time between the completion of the primary dose and the booster dose of Pfizer and Moderna vaccines has been shortened to 5 months. And immunocompromised children between the ages of 5 and 11 years old can receive a third primary dose of vaccine. Parents should speak with their pediatrician to determine if their child needs a third dose. And before I continue on here, I just would like to say this. For a little while yesterday, I joined the team passing out some of the masks that I spoke about earlier down at the Menominee Valley vaccination and testing site. It was unforgivably cold, I can tell you that. The people working there are champions in this pandemic, along with the healthcare workers in our hospitals and clinics and at pharmacies. And as mayor, I'd like to express my appreciation to all the medical and public health professionals who are stepping up. So tomorrow, January 12th, 2022, I am proclaiming it to be Healthcare Professionals Day throughout the entire city of Milwaukee. There are thousands and thousands of people who have earned this recognition, and we want to recognize them and appreciate them for their work. One of them is Dr. Ben Weston, and we want to thank Dr. Weston for his work here on these briefings, for his work in the county, for his work in emergency medicine as well. So thank you, Dr. Weston, and with that, I'll hand it off to you.
Well, thank you, Mr. Mayor. I deeply appreciate that. Good afternoon, everyone. First, to our numbers, we are currently seeing in Milwaukee County an average of 1,107 new cases per day, and now about 6 deaths per day. Our trends continue to rise. There does appear on the dashboard to be a decrease in cases. Now, every state in the country is continuing to see an increase in case numbers. Based on that, I'd say it's unlikely that this is a true decline so much as a data delay. So we'll certainly continue to follow that. Meanwhile, positivity remains extremely high at 36%. Hospitalizations continue to rise, now at 771 COVID positive patients admitted. And in line with previous surges, we're now seeing the delayed, but certainly now present increase in deaths from COVID as well. Clearly, we face unprecedented challenges. The Omicron variant continues to break record after record for COVID cases, positivity, and hospitalizations here and around the world. But that variant will not be with us forever. Looking at data from South Africa, the one country where the surge from the variant has finally started to definitively decrease, it appears that we likely have a few more weeks of increases in cases before we may begin to see a downtrend nationally. But those few weeks will be critical. Distancing, ventilation, and using high-quality masks will help us to flatten that curve and maintain our health system capacity. Now, to be clear, our health systems are currently deeply strained. Elective procedures and surgeries are being broadly postponed and canceled due to limited capacity. Outpatient clinics are being closed in order to relocate that staff to cover hospitals where large portions of employees are out sick, compounding existing staff shortages. Our hospitals lack beds to admit patients, which leads to boarding in the emergency department. That's when a patient will be admitted, but remain in their emergency department bed, causing significant obstructions to the flow of that emergency department, as well as to the broader hospital and institution. And all of this is happening in the setting of still skyrocketing cases nationally and unprecedented positivity. So this is why limiting spread and flattening that curve is so critical right now. As we start 2022 with this as our backdrop, it's easy to fall into the feeling that this will just be another year of the pandemic, another year of high disease burden, hospital capacity issues, and endless variants. However, there are reasons to be hopeful. Due to progress in technology and medicine, an improved understanding of the virus, and the work that so many of you are doing, this year can be different. This year can be better. First and foremost, we start this year with 59% of our county at least partially vaccinated. It's not enough, but that number was 1% a year ago. And whereas a year ago, only 10% of those first dose vaccinations went to our most vulnerable communities, we've shifted that paradigm. Now over 50% of first doses go to our most vulnerable. We also start 2022 with new therapeutics, such as the upcoming Pfizer pill, that look to have a major impact on outcomes for high-risk individuals who contract COVID. We also enter 2022 with more pediatric vaccinations on the horizon, with the promise that nearly anyone will soon be able to make that choice to get themselves and their families protected from COVID. Now, without a doubt, challenges remain, and though we move in the right direction, that road will undoubtedly bend and curve. But we can work together to protect not just ourselves, but our community. Now is the time to step up, to get yourself protected, to bring your family member to get protected, or to talk to that one neighbor, that coworker, or that friend who's been on the fence. Help them make the decision to get themselves protected as well. Thank you and stay safe, and I'll hand it to Dr. Koss.
Thank you, everyone. Good afternoon, and thank you, Dr. Weston. My name is Dr. Allison Koss. I'm the Chief Medical Officer at Progressive Community Health Centers, one of the FQHCs in the Milwaukee community. I'm here to speak with you a little bit today about extending a plea and all of those hopeful things, as well as the challenges Dr. Weston outlined. We do have to recognize, again, the increased rates of positivity, the increased hospitalizations, and sadly, the increased deaths related to COVID disease within our community. With that, you can appreciate that those healthcare providers within our health systems, as well as our urgent cares, are becoming fatigued, but also impacted themselves by COVID disease, but also very much hold on to that want to serve our community and to care for all of those folks seeking care. So a couple of rules of thumb that would be really important to remember as community members are impacted by respiratory disease is really to consider, how sick are you feeling? If I am feeling sick and feel short of breath or have chest pain, I should seek immediate care. Go to an ER, go to an urgent care center that can meet your needs and offer clinical care. If I'm feeling just simple cold symptoms and I'm curious to know whether I have COVID or not, an urgent care may be appropriate for you. However, a testing center could most likely process your need for a test and get your result much quicker than going through the urgent care assessment and evaluation. And certainly, if I'm a community member that's just been exposed and I'm feeling just fine, there is no urgency to go to an urgent care or an ER to seek treatment. Please find a testing center locally that can meet your needs. The best place to identify open testing centers is through healthymke.com, which is an incredible link that's been developed locally. It lists hours of operations, walk-in status, transportation, as well as all the numerous sites that span across the health departments, community health centers such as ours, urgent cares, as well as other retail pharmacies that can help support testing. The last thing I would just like to wrap up briefly with is consider using your PCP. Our PCPs know us best. Our PCPs are equipped to at least take a phone call or have you speak with a nurse to say, yes, you should go. No, please wait and come see us. Or alternatively, again, find an appropriate testing site. I would endorse, even if you're feeling ill, please continue to mask and mask at home until you can be tested and find out if you have COVID. Because again, with all the distinguished speakers earlier today, we really need to consider protecting ourselves, but our family and those that we come into contact with, even if we have a simple cold while we wait for COVID results. I appreciate your time and thank you. Catherine, I'll turn it to you.
Thank you, Dr. Koss. Now we will move into our media Q&A portion of our briefing. Our first question does come from Nick Borg with WISN 12 for Dr. Koss or Dr. Weston. He's wondering if you can talk about the new COVID oral antiviral treatments. Can you speak to the idea that some might view them as an alternative to getting vaccinated?
Sure, I can start on that. So there's a number of oral antiviral treatments that are on the horizon. I think the Pfizer one seems to be the most promising, but there's a number. As far as whether this is a reason to not get vaccinated, I would say the answer is absolutely no. These medications are used for high-risk individuals to decrease the likelihood of severe disease or hospitalization. Number one, prevention is always better than treatment, especially effective and safe prevention with nearly no side effects, which is the case with the vaccines. Number two, the vaccines have a higher percent effectiveness typically than these medications do. So the vaccines are actually more effective at keeping you out of the hospital than these medications are. Now, of course, putting the two together, getting a vaccine, if you happen to have a breakthrough infection and you are high risk taking these medications, is going to be the best bet. But in no way are these medications substitutes or safe to use as substitutes for the vaccine.
Our next question is probably directed for Dr. Weston as well, from Gabrielle Mays with FOX6. She said, some people have come to FOX6 with concerns about possible illegitimate testing sites. What do you advise for people looking for a legitimate COVID-19 testing site?
I can actually answer that one. And I think this is a very important question. So if you are looking for a legitimate place to get tested or to get a vaccination, I highly recommend you visiting healthymke.com. You can go to that website. We have all of the folks who are testing folks or giving vaccinations listed there, and those are trusted folks. So healthymke.com is the website to visit.
Thank you, County Executive. Our next question is from Kent Wainscott with WISN 12 for Dr. Weston. He says, UW Health is telling people today that if they can't easily get access to a test and if they have any mild symptoms, they should not wait to get tested and should self-isolate. What are your thoughts on that? And do you think people are likely to follow that guidance?
Yeah, I think in this state that we're in nationally with testing shortages, I think it is reasonable guidance. And Dr. Koss spoke to this as well. Look, if you have the symptoms of COVID, and remember the symptoms of COVID are the same as the symptoms of a GI bug, it could be vomiting, the symptoms of a cold, that could be congestion and a runny nose. These can certainly be the symptoms of COVID. And while they may be mild for you, the person that you give them to, it may not be as mild and they may end up in the hospital. So if you have these symptoms, I would certainly isolate yourself. Keep away from others until you can get that test. We're looking at upper 30% positivities in the county. So if you have these symptoms, chances are pretty good that that might be COVID. So certainly isolating yourself, and really, even if it's just a bad cold that you have, you really don't want to spread that to others either. So just like we used to do years ago, if you're sick, if you have a cold, stay away from others. Cover your mouth when you sneeze, wash your hands. And now that they're much more available, certainly wear a mask.
Our next question comes from Eric Gunn with the Wisconsin Examiner. And I know there's some conversation in the chat, so thank you for the important dialogue. I'll ask the question in case there's any additional context here for Dr. Koss. Eric is wondering if you can please define PCP for those who might not recognize the term.
Thank you for that clarification, Eric. PCP, as noted in the chat, is primary care provider or even a clinic that you previously received care from.
Excellent. Our next question is from Chuck Kornbach with WUWM for Mayor Johnson or others. Why have so many masks been given away so quickly? What are the prospects of getting more masks from the state?
Thank you for the question. I think that masks have been given away so quickly because we messaged, I think, pretty effectively to the community that these more effective masks would be available at the sites that were mentioned, at our public library sites and at our testing sites. Although I should note that the library has now run out of masks. But I think that's the reason why, is because we were effective in getting that word out to folks in the community, and they want to make sure that they have the most effective mask for mitigating the spread of COVID. Now, on the other question about securing additional masks, we're actively working with the state to secure additional masks as we speak. So that's our goal, is to bring in more masks from the state. Hopefully we'll be able to resume mask distribution by Thursday.
Thank you, Mayor. I've got one more question from TMJ4, and Eric, I see your note there. So our next question is for Dr. Weston, Mayor Johnson, or anyone else on the call. Would you like to see a mask mandate? And specifically for Mayor Johnson, are you behind a mandate as well?
Well, I think the first one's directed at me. So I'll say two things about masks. The first thing I'll say is I don't think enough people are wearing masks. I went out yesterday to the grocery store, and probably around 70%, 75% of people were wearing masks. That's more than I saw a month or two ago, but it still just isn't enough. It's not enough with the case burden that we're seeing, with the positivity we're seeing, and maybe most importantly, with the elevated and increasing number of hospitalizations we're seeing. So getting more people to wear masks is going to be important, and wearing masks is important. The second thing about wearing masks is, and Mayor Johnson talked about this, and County Executive Crowley talked about this, we're talking about high quality masks here. This isn't the same variant that we had 21 months ago. This is a far more transmissible, far more contagious variant. And that means you need to step up your mask game. That means cloth masks, they're better than nothing, but they're not nearly as good as a paper surgical mask, which in turn are not nearly as good as a KN95, an N95, a KF94. These are all the same sort of masks, just different credentialing. So really stepping up your mask to these higher quality masks, whether you pick them up at the health department, whether you order them online, they're relatively inexpensive now through the Milwaukee Health Department. They're free to get, and sounds like more coming. So certainly get yourself one of these masks. Keep yourself as protected as you can.
Lynn, let me be clear on this yet again. I'm not against masking. That's why I'm supportive of the mask advisory that is currently in place and instituted by the City of Milwaukee's Health Department. I'm interested in having conversations on a mask mandate if done the right way. But let's not forget the fact, right? Let's not forget the fact that the most effective tool that we have to mitigate the spread, to make sure that symptoms are mild, to keep people out of the hospitals around COVID is for folks to get vaccinated. As I said, in my comments earlier, the number of people that we have vaccinated in the city of Milwaukee, in Milwaukee County, is far too low. We need to boost that number up. And so I'm interested in having conversations about masks. That's great. But at the end of the day, if we really want to fight COVID, then all of us, including the folks who are, pushing, mask use, should be driving more people to these sites to get vaccinated. That's what we should be focusing on, is getting more people in this city and in this county vaccinated. And that's what my message is going to be, consistent with what the health professionals and the experts on COVID-19 has been. And that's where I stand on the issue.
We have a few more questions in the chat here. Eric Gunn is posing the question to those, to any of our speakers. Some people seem to be of the opinion that Omicron is mild and that continued alarm is excessive. What is your message to that claim?
Yeah, I think that's an important question, Eric. And I think it often goes hand in hand with the question of, should we just let it rip? This is a more transmissible variant. Is this our opportunity for herd immunity? These sort of questions come up a lot. I think when considering it, there's really two aspects to consider. And it's the individual effect and the community effect. So when we think of the individual effect of Omicron, your individual disease may be more mild. Certainly on a community level, it seems to be more mild. But as an individual, mild illness from COVID can still be pretty uncomfortable. We're talking, I see these patients every day in the emergency department. And if you're unvaccinated, you're getting COVID, quite often that means days or weeks of body aches, of fevers, of headaches, of cough, of shortness of breath. It's more mild than being hospitalized, certainly. But mild disease with COVID is not, a mild cold. That's typically not what we're talking about. So I think you have to think about that. You also have to think about long-term effects. Even if you do have what you consider a mild case of COVID, you're still at risk for long-term effects of COVID. Some can be mild and some can be debilitating, depending on the individual. Now, even if you hear all that and you say, it's worth it, I'll take the risk, that's fine. You have to think of others. You have to think of the people that you may transmit to, or by letting it just go wild, who else is going to be transmitted to? There's still plenty of children who are unvaccinated or can't get unvaccinated. There's people with medical conditions that preclude them from vaccination. There's people with medical conditions that make the vaccine a lot less effective for them, or people with immunocompromise or older individuals that can get really sick if they have COVID, even if they're vaccinated, even if they're boosted. They're still vulnerable populations. So we have to think of them. And then, of course, we need to think of our health systems. The more people that get COVID, a certain percentage of those, even with Omicron, a certain percentage of those are going to get hospitalized. A certain percentage of those are going to need the ICU. A certain percentage of those are going to need ventilators. And if we just let Omicron go wild and we don't try to contain it, we don't flatten that curve, we're going to overwhelm our health systems. And it turns out the people that need health systems are everyone. Everyone watching this needs a health system, whether you have a medical condition that makes you need a health system, or whether you slip on the ice walking out to your car today, you may need the health system. So that's something we all need, and we all need to be cognizant of.
A few more questions in the chat here. Our next one is from Kent Wayne Scott with WISN 12 for Dr. Weston. He says, it appears Wisconsin hit a record high for hospitalizations today. Do you see that trend continue as we expect case numbers to do in the days and weeks ahead?
Yeah, Kent, I think that number will rise for a bit here. Once we see a decline in cases, I think it'll probably be a week or so. That's what we've been seeing until we start to see that decline in hospitalizations. And then unfortunately, deaths will linger after that. That's the trend that we've seen variant after variant after variant. It's cases followed by hospitalizations, followed by deaths. So hopefully in the next 1, 2, 3 weeks, we'll start to see those cases start to decline. And I think soon after that, we'll start to see hospitalizations decline as well.
One final question I'm seeing in the chat here from Frank Healy with CBS 58 for Mayor Johnson. He's wondering, what kind of mask mandate would you support, or what qualifiers would it take for you to support one?
Thank you for that question. I think that in a mandate, we should be driving people towards education, including education about vaccination, right? Because again, our numbers are too low with vaccination in this city. We need to encourage more people to go and get vaccinated against COVID. Mask wearing simply just will not be enough. That's a great second layer, but the first layer of protection, the best tool that we have, is getting vaccination. So education should certainly include that. I'd be interested in what thresholds would look like for activating a masking mandate or a time period in which there would be one. And then lastly, as I've said, all along, right, my decisions regarding COVID are going to be informed by the experts on COVID-19 and health professionals. And so I would like to have the weigh-in and opinion of those individuals and organizations on anything that we were to put forward for the public. So those are the things, outright that I would be considering. I have not yet still seen the substitute ordinance that members of the Common Council are working on. I'm eager to see that when it does come across my desk. But starting off, those are going to be the areas that I'll be looking at in a potential mandate.
Thank you, Mayor Johnson. At this point, those are all of the questions in our chat. So that does conclude our briefing for today. Thank you all for joining us, and we'll see you next week.
Thanks, everyone.